Rubraca is a cancer medicine that interferes with growth and spread of cancer cells in the body. Rubraca is used to treat ovarian cancer, fallopian tube cancer, or primary peritoneal cancer, cancer of the membrane lining the organs inside the abdomen. Rubraca is sometimes used to these conditions only if your cancer has a specific genetic marker, an abnormal BRCA gene. Your doctor will test you for this gene. Rubraca is also used to treat prostate cancer. It is given for these conditions when the cancer has spread to other parts of the body, and surgery or other cancer treatments didn't work or have stopped working. How to use. Take Rubraca exactly as prescribed by a doctor. Follow directions on a prescription label and real medication guides or instruction sheets. Your doctor may occasionally change your dose. Rubraca is usually taken once every 12 hours, with or without food. If you take Rubraca for prostate cancer, you may also be treated with another medicine called gonadotropin-releasing hormone. Gonadotropin-releasing hormone helps prevent the testicles from producing testosterone. If you vomit shortly after taking a dose of this medicine, don't take another dose. Wait until the next scheduled dose to take the medicine again, but do not take two doses at the same time. You may need frequent medical tests, and your cancer treatments may be delayed based on the results. The starting dose of Rubraca is 600 mg twice a day for a total daily dose of 1200 mg for tablets. Contraindications. Using Rubraca may increase your risk of developing serious bone marrow problems or other types of cancer, such as leukemia. Ask a doctor about your specific risk. Rucaparib can harm an unborn baby if the mother or the father is using this medicine. If you are a woman, you may need to have a negative pregnancy test before starting this treatment. Don't use Rucaparib if you are pregnant. Use effective birth control to prevent pregnancy while you are using this medicine. If you are a man, use effective birth control if your sex partner is able to get pregnant. Keep using birth control for at least 3 months after your last dose. Tell doctor right away if a pregnancy occurs. Don't breastfeed while using this medicine and for at least 2 weeks after your last dose. Warnings. Rubraca can cause leukemia or serious bone marrow problems. You may get an infection or bleed more easily. Call a doctor if you have unusual bruising or bleeding, blood in the urine or stools, shortness of breath or signs of infection, fever, feeling weak or tired, weight loss. Rucaparib could make you sunburn more easily, avoid sunlight or tiny baths. Wear protective clothing and use sunscreen when you are outdoors. Rubraca side effects. Get emergency medical help if you have signs of an allergic reaction to Rubraca, hives, difficult breathing, swelling of a face, lips, tongue, or throat. Call a doctor at once if you have blood in the urine or low blood cell counts, fever, chills, tiredness, mouth sores, skin sores, easy bruising, unusual bleeding, pale skin, cold hands and feet, feeling lightheaded or short of breath. Your cancer treatments may be delayed or permanently discontinued if you have certain side effects. Common Rubraca side effects may include low blood cell counts, shortness of breath, upset stomach, loss of appetite, nausea, vomiting, diarrhea, constipation, changes in your sense of taste, dizziness, feeling weak or tired, increased sensitivity to light, rash, or abnormal liver or kidney function tests.